Happy New Year to all of you. Your physiomechanist is back with a new video, and in this video we will discuss about Duchenne Muscular Dystrophy and little bit about Becker's and LimbGirdle Muscular Dystrophy. So let us begin. Duchenne Muscular Dystrophy is the most common form of muscular dystrophy, and it is common in males because of X-linked inheritance. So basically what happens in Duchenne muscular dystrophy, there is a gene called dystrophin gene that is present on the short arm of X chromosome. So it is a X-linked disease. So there will be genetic defect in the dystrophin gene which is present on the short arm of the X chromosome, which will lead to no or very little or defective production of dystrophin protein. Dystrophin protein is essential for the integrity of the muscle cells. If there will be no or little or defective production of dystrophin protein, the muscle cells will die progressively, leading to progressive muscle weakness, and the muscle cells will be replaced by fat cells, causing pseudo hypertrophy. So what are the clinical features? So DMD starts presenting at the age around 5 to 6 years of age, and there will be delayed development milestones. So जो ये बच्चे होते हैं इनके अंदर जो ग्रोथ और डेवलपमेंट माइलस्टोन्स होते हैं वो डिले हो जाते हैं. थोड़ी सी इंटेलेक्चुअल एबिलिटी के अंदर भी इफेक्ट आते हैं. हर एक के अंदर नहीं देखे जाते बट होते हैं. एंड सम डिलेज इन द ग्रोथ माइलस्टोन्स, and the patient will show typical posture because of the weak shoulder girdle muscles. There will be awkward positioning of the shoulder and the arm. The belly will be protruded out, the abdomen will be protruded because of the weak abdominal muscles, and the back will be in the form of swan back. The lumbar lordosis will be increased, and the patient will walk on toes because of the tight calf muscle, which will raise the heels. So this is the typical posture that patient exhibits. Other than that, the patient exhibit Gower sign. Gower sign is typical of Duchenne and Becker's muscular dystrophy. In Gower sign, the patient, because of lack of strength in the lower limb muscles, the patient uses upper limbs to straighten up the legs to stand up. So you can also see the Gower sign in the diagram. And basically what happened to these patients, जो पेरेंट्स होते हैं वो मोस्टली कंप्लेंट लेके आते हैं फिजिशियन के पास कि जो बच्चा है वो चल तो रहा है बट गिर जाता है बार बार, है ना, अपने टोस को उठा के चल रहा है और वो देखते हैं काफ मसल काफ़ी टाइट हो रहे हैं. एंड यूजुअली प्रॉक्सिमल मसल्स पहले इफेक्ट होते हैं. प्रॉक्सिमल मसल्स के अंदर हमारे हिप गर्डल मसल, लिम्ब, अपर लिम्ब, शोल्डर गर्डल मसल्स, ट्रंक मसल्स, नेक मसल्स ये आ जाते हैं. उसके बाद इवेंचुअली एज द पेशेंट एजेस, ठीक है ना, तो उसके डिस्टल मसल्स भी कमज़ोर होना शुरू हो जाते हैं, एंड ही टोटली बिकम्स डिपेंडेंट ऑन समवन, एंड द इंडिविजुअल लूजेस द एबिलिटी टू वॉक बाय द एज ऑफ 12 to 13 years ऑफ एज. तो ये हैं क्लिनिकल साइंस डुशेन मस्कुलर डिस्ट्रॉफी के. बेकर्स के भी ऑलमोस्ट सेम है, बट थोड़ा एज का फ़र्क पड़ जाता है कि उनमें थोड़ी सी लेट स्टार्ट होती है एंड थोड़े से माइल्डर वर्जन है डुशेन्स के. डुशेन्स मस्कुलर डिस्ट्रॉफी के अंदर पेशेंट यूजुअली डाइज बिकॉज ऑफ रेस्पिरेटरी एंड कार्डियक फेलियर, बिकॉज इवेंचुअली स्केलेटल मसल्स तो इफेक्ट हो रहे हैं बट कार्डियक मसल्स और रेस्पिरेटरी मसल्स भी इफेक्ट होने शुरू हो जाएंगे एक टाइम पे. So what are the difference between the Duchenne muscular dystrophy and Becker's muscular dystrophy? So the first point, dystrophin gene. The dystrophin gene is absent or non-functional in Duchenne muscular dystrophy, and it is partially functional in Becker's muscular dystrophy. The incidence of Duchenne muscular dystrophy is 1 in 3,600 male birth. But for BMD, the incidence is 3 to 6 per lakh male birth. Mean age of onset for DMD is 3 to 5 years, but for BMD it's about 12 years. the mean age at which the person becomes non-ambulatory, मतलब wheelchair पे आता है, तो that for DMD it is 12 years and for BMD it is 27 years. The mean life expectancy for DMD is mid 20s and for BMD it's 40s. Onset of cardiomyopathy in DMD usually follows skeletal progression, but in BMD may present before skeletal symptoms. So this was the difference between DMD and BMD. So what are the diagnostic procedures for Duchenne's and Becker's muscular dystrophy? So we have muscle biopsy test, we have genetic testing, we have creatine kinase testing. So in creatine kinase test, we test for the blood levels of creatine kinase. So usually creatine kinase is present in the muscle cells, but when the muscle cells dies or they are destroyed, the level in the blood is increased. So it may point out to muscular dystrophy. Other than that, we can go for muscle biopsy, where we can observe the muscle, whether there is dystrophin present or not. If there is patchy appearance of dystrophin in the muscle, it points out to Becker's muscular dystrophy. If there is no dystrophin, it is Duchenne's muscular dystrophy. Then there is genetic testing, in which gene testing on the genetic level is done to detect the dystrophin gene. Okay, so this is about the diagnosis of Duchenne's and Becker's muscular dystrophy. So now we will talk a little bit about LimbGirdle muscular dystrophy. So the basic difference that LimbGirdle muscular dystrophy holds from Becker's and Duchenne is that it is not sex-linked. It is either autosomal dominant or autosomal recessive. There are many variants of LimbGirdle muscular dystrophies in which both males and females are affected equally, and some variants progresses very slowly and some very fast, but they are not as severe as Duchenne's or Becker's muscular dystrophy. Mostly the limb girdle muscles like shoulder girdle and hip girdle muscles are affected. The other muscles are spared, and there are no cardiomyopathies as compared to Becker's and Duchenne's muscular dystrophy. The age of onset of limb-girdle muscular dystrophy is usually between 10 to 30 years of age. Some variants progresses very fast and some variants are slow in progression. Usually it is said that when the limb-girdle muscular dystrophy starts at an earlier stage, it is more severe and disabling than when it starts at adolescent or adulthood. So this is about limb-girdle muscular dystrophy, and it is not as severe as Duchenne's and Becker's muscular dystrophy. Coming on to the treatment of Duchenne's and Becker's muscular dystrophy. So right now there is no cure for this disease, but symptomatic and supportive treatment through corticosteroids and physiotherapy is being provided. Corticosteroid therapy will prolong the ambulation by slowing down the degeneration of the muscles. How does physiotherapy helps the patients of muscular dystrophy? So basically, physiotherapy supportive treatment provide करती है and delays the progression of the disease and also prevent the complications such as contractures and deformities which are common in these patients. एंड इसका कुछ ऐसे प्रोटोकॉल होता है, पहले असेसमेंट की जाती है पेशेंट की पूरी रेस्पिरेटरी कैपेसिटी, एमएमटी ऑफ डिफरेंट मसल ग्रुप्स, एंड ग्रेडिंग के ऊपर एक्सरसाइज प्रोटोकॉल बनाया जाता है. अगर मसल्स बिल्कुल ही एट्रोफिड हो चुके हैं तो पैसिव रेंज ऑफ मोशन एक्सरसाइजेस कराई जाती हैं. अगर मसल्स कुछ वर्क कर रही हैं तो उनसे उतना वर्क करवाया जाता है, ओवरलोड नहीं करवाया जाता. एंड टू प्रिवेंट कॉन्ट्रैक्चर्स वी प्रोवाइड स्ट्रेचिंग के साथ साथ ब्रेसिंग की जाती है. एंड अदर देन दैट गेट ट्रेनिंग, बैलेंस ट्रेनिंग, रेस्पिरेटरी कैपेसिटी को इंक्रीज़ करने के लिए स्पायरोमीटर के साथ ब्रीदिंग एक्सरसाइजेस करवाई जाती हैं. इसके अलावा एक्टिविटीज़ ऑफ डेली लिविंग एंड मैट एक्सरसाइजेस भी करवाई जाती हैं. एंड हाइड्रोथेरेपी इज़ ऑल्सो प्लेइंग ए गुड रोल इन इम्प्रूविंग द फिजिकल स्टेटस ऑफ मस्कुलर डिस्ट्रॉफी पेशेंट्स. तो ये था ट्रीटमेंट फिजियोथेरेपी इन नटशेल. वैसे तो काफ़ी डिटेल में होता है, बट इन नटशेल क्योंकि वीडियो को शॉर्ट रखना है इस करके दिस इज इट. I hope you understood. So please like, share, comment, subscribe and press the bell icon. Thank you.